Back in this country, the point of a publicly funded healthcare system is that it's there when you need it. But as CTV News investigation reveals, a lot depends on where you live. People outside of cities are far more likely to arrive at an emergency room only to find the doors shut. As part of our critical care series, CTV's medical specialist Avis Favreau looks at the divide and the desperation.
This fight at a party is an example of why emergency doctors and nurses are worried. 3 teens were stabbed and driven to the emergency in Clinton, Ontario, just 2 kilometers away. When they arrived, they found it was closed for the night, with just a phone to call 911.
We're playing Russian roulette here. Sooner or later, something's going to happen and it's going to cost somebody their life, and it came close this time.
The victims ended up in 2 hospitals 20 and 80 kilometers away, and they survived. But it's a new trend among rural hospitals in Canada, with CTV News conducting a survey of provinces and territories, finding this year so far there have been over 1,280 times that hospitals, mostly rural, have closed their doors overnight for a full day or longer, usually because they can't find enough nurses or doctors.
Every closure runs the risk of a bad outcome for somebody. It's not okay. Under any circumstance, it's not okay.
This hospital in Chesley, Ontario, has been closed over 150 times this year alone, leaving patients like Reverend Craig Bartlett feeling abandoned.
This place is my primary healthcare provider.
He has no family doctor, hasn't been able to find one in over 2 years, so this hospital is his lifeline.
How do they think that this is improving my healthcare situation at all? It befuddles me, and it boggles the mind.
This adds time for travel, 30 to 200 kilometers to the next ER. It also adds to the risk of those who may be suffering heart attacks or strokes.
I'm not sure if anybody's actually examining the harms that are coming from this.
Dr. David Savage hopes to study the closures in Ontario and their effects.
When your ER closes and patients can't be assessed, well, the possibility of a poor outcome or something being missed goes up significantly.
ER doctors and nurses tell CTV News they are frustrated beyond belief that provinces haven't appropriately planned and prepared by training staff and maintaining basic rural health care.
These kind of closures mean that government has failed to meet their end of the social contract with Canadians in terms of providing them assured access to quality emergency care.
And late today, Canada's emergency physicians told me they've been asked to present to the country's deputy health ministers next week, talking about a national forum to help solve the urgent crisis in emergency care. Avis Favreau, CTV News, Toronto.